living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
MDs, PAs, RNs, NPs, FNPs. Even if we know what the abbreviation stands for, we don't always know the differences between the types of healthcare professionals and what they're qualified to do when providing care. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Sarah Medley. Today we'll talk about some of the healthcare professionals out there, especially nurse practitioners. Stay with us. Welcome back. Joining us this morning is Erin Kunzweiler, a family nurse practitioner. Thanks for being here, Erin.
You're welcome. Thanks for having me.
What is a family nurse practitioner?
So when we talk about nurse practitioners in general, we fall into the class of healthcare providers that are termed advanced practice providers, or APPs. So nurse practitioners and physician assistants would fall into that category. So a nurse practitioner is a registered nurse who's had a baccalaureate degree and then advanced training at the graduate level to become licensed as a nurse practitioner.
Can you talk to us more about the training and some of the requirements that you had to go through when becoming a family nurse practitioner?
Sure. So as I said, you first have to be a registered nurse and you have to have a baccalaureate degree. Then there's graduate school, which can be at the master's level or at the doctorate level. The requirements for that are, each institution has a little bit of a different requirement, but it would be based on your experience in nursing, how many years you practice, your GPA at the undergraduate level, graduate entrance exams. So those requirements have to be met, and then it's either a 2 to 3 year program, again, depending on whether you do the master's or the doctorate program. And so in that 2 to 3 years, the curriculum is classroom learning, where you're learning about disease and pharmacology. And then you have your clinical rotations, and those are out usually in the community where you came from, and you're set up with various mentors who have expertise in the specialty fields from family practice, pediatrics, surgery, emergency medicine. So after all of that is done, then you sit for the national board licensing exam, and once you've passed that, then you get your state license. Once you have both of those, then you're okay to practice in the state where you have a license.
When it comes to patient care, then, what are you able to do?
So as a nurse practitioner, your scope of practice includes assessing patients, diagnosing, ordering diagnostic tests, interpreting them, and then of course all of the follow-up that would be involved in that. We also have a big focus on preventative health care, preventative health care, so a lot of education is involved with that. So really the same as a generalist physician, but certainly you have to do it within your nurse practitioner scope of practice.
Where would a person receive care then from a nurse practitioner?
So in the healthcare arena, you'll find nurse practitioners pretty much in every setting. So you'll find them in private medical clinics, which is where I work, working for hospitals, either in their kind of family practice clinics, specialty clinics, urgent cares, emergency rooms, the prison system, the public health system, and then in education. So pretty much across the board in the healthcare arena, you'll find nurse practitioners.
Can a nurse practitioner have more than one specialty?
They can have more than one specialty, but I'll backtrack a little bit. When I talked about going to graduate school, there's several tracks that you can pick. So I did the family practice track. There's the nurse anesthetist track, psychiatric track, pediatric track, midwife track. So you can specialize initially in any of those tracks, and you would come out with certification then to practice in that arena. After that, though, you can get any number of specialty certifications, whether it's dermatology, oncology, cardiology, gerontology. And then, of course, depending on where you end up practicing, if you're, say, practicing in dermatology, you're going to sort of do an apprenticeship with, the specialist physician that you're working with, and that's kind of hands-on learning. And sure, you can have multiple specialties, though.
Talk to us about why you chose family nurse practitioner as opposed to another specialty.
I think initially I like managing chronic diseases kind of across the board. I like to figure things out. And in family practice, you're kind of, you're taking care of patients across the lifespan from newborn to geriatrics. And you're presented with a wide array of pathology that you have to sort out. And I like doing that. Once you've kind of figured it out or, sent them down the track of the specialists, then it's a very more narrow focus. And that's why I chose family practice.
I believe that you also teach some courses at some point in your career. Can you talk to us about that?
Well, I did. I was teaching at Carroll College, nursing in the baccalaureate program, and I did that for about 4 years while I was still practicing, and that was a great experience. I think it made me a better nurse practitioner because when you have to teach, everything like physical assessment, it certainly makes you a better practitioner. So that was a great experience.
So in closing, we've got just a few seconds left.
Okay.
What's your best advice to a nurse who wants to become a family nurse practitioner?
Practice as a nurse before going back to graduate school. Nurse practitioner school is not a medical school, and you really need to have a solid foundation in nursing before you go back to graduate school to become a nurse practitioner.
Thank you so much, Erin.
You're welcome.
We need to take a quick break, but coming up next, we'll talk about the differences between a nurse practitioner and a medical doctor. Stay tuned. We'll be right back. Welcome back. We're talking to family nurse practitioner Erin Kunzweiler, and now joining us is Dr. Douglas Kunzweiler, an MD, or Doctor of Medicine. Thanks for joining us.
Thanks for having me.
Absolutely. So Dr. Kunzweiler, we talked to Erin about nurse practitioners, and it sounded very similar to what doctors do in terms of treating patients. Can you talk about the differences between being a medical doctor and then your perspective of the differences with a nurse practitioner?
Sure. So it really is a matter of depth of study more than anything else. Medical doctors, whether you're an MD or an osteopath, have first an undergraduate degree. That may or may not be in a biological field. They then go to a medical school, and most medical schools are 4 years in length. After that, then they do a residency, and the residencies vary depending on the specialty. Family practice, for instance, is 3 years long. General surgery is usually 5 years long, and so they vary. A nurse practitioner has, first of all, her 4-year nursing degree, and then a 2 or 3 year nurse practitioner program. So the length of study is greater for a physician. But the thing I want to stress is that we're all practicing the same medicine. We study from the same textbooks, we attend the same conferences, we follow the same scientific literature, and we all try and follow best practices. And so we're all practicing scientific Western medicine. The difference is that physicians have a longer course of study, and therefore they have more experience and more in-depth training, but we're all doing basically the same thing.
So maybe we should take a step back, and you mentioned really a doctor of osteopathy.
Correct.
Or a medical doctor. So there's medical doctor, doctor of osteopathy. Can you talk about the differences between the two?
Yeah, so everybody has all these initials after their name, MD and DO, and that is confusing for people. Historically, osteopathic physicians had a different perspective on the causes of disease back in the 1800s when that began. And they were much more like chiropractors, and they did a lot of manipulation, thinking that was the source of disease and that was the way to fix it. However, as time went on, they adopted the scientific Western medicine curriculum. And so for the last 75 years, osteopathic schools and MD schools have pretty much identical curriculums. So we both practice Western scientific medicine. MDs and DOs both compete for the same residency slots. And so from a practical standpoint, there's no difference at this point. You'll find ENT surgeons who were osteopathically trained, and you'll find general surgeons who are osteopathically trained. You'll find cardiologists who are MDs, cardiologists who are DOs, but we're all practicing the same medicine.
How do the MDs and DOs then collaborate with nurse practitioners or even physician assistants?
Yeah, physician assistants are a relatively new practice that were designed to sort of increase the number of patients that a physician could be responsible for and take care of. And so they attend a school that is usually 2 or 3 years long that includes a lot of mentoring, and they do the same thing that nurse practitioners do and the same thing that physicians do. They assess patients, they diagnose them, and they treat them. One of the differences is that PAs in most states have to have an affiliation with a physician, and that physician has to oversee their practice, review their charts, oftentimes countersign orders. And nurse practitioners in most states are free to practice independently. Having said that, we all collaborate with each other. So nurse practitioners, as I said, their training is shortened, and so they use physicians as mentors and as people that they can turn to when they have questions that they feel are beyond their expertise. As a physician, I do the same thing. I have patients I see that present me with unfamiliar problems, and I turn to other physicians who have specialties that can help me manage these patients. So we sort of all work collaboratively for the best interests of the patient. And it's just a matter of degree, I would say.
Switching to Aaron, then how do you practice, Aaron?
Yeah, so to talk about the point he made as far as independent practice, in the United States for nurse practitioners, each state board of nursing sets the bylaws on independent practice. So Montana is an independent practice state, so I don't have to have a collaborative agreement with a physician. Personally, I am in private practice, but I'm in private practice with 3 physicians, 2 MDs and 1 DO. So I set myself up that way so that I had mentors, especially in those early years.
So how does a patient know who's treating them? An MD, a DO, a nurse practitioner, or even a physician assistant?
Well, I think professionally, the right thing to do when you introduce yourself to a patient is let them know what you are. Doug would introduce himself as, Dr. Kunzweiler, and that's kind of a general, everybody knows then you're a doctor. But I introduce myself as Aaron Kunzweiler, NP, and physician assistants do the same. And as a patient, you should absolutely have a right to know what provider is treating you.
Okay, thank you both. We need to pause for a short break, but coming up next, how much do healthcare professionals work together to coordinate your care? We'll talk about that and what you need to do to be an informed and engaged patient right after this break. Stay with us. Welcome back. Nurse practitioner Erin Kunzweiler and Dr. Douglas Kunzweiler are still with us. And we're going to talk more about the relationships between physicians, nurse practitioners, and physician assistants, and what you need to know as a patient under the care of any of these healthcare professionals. So welcome back.
Thanks.
Sometimes a person makes an appointment with their doctor, whether MD or DO, and when that person goes to the appointment, they're surprised because maybe a nurse practitioner or a physician assistant comes into the room. So talk about that, and is it okay for the patient to be not okay with that?
Yeah, absolutely. Really, that shouldn't happen. When you make an appointment, certainly at any clinic, you should know who you're seeing, and that should be made very clear by the the front desk personnel that you're seeing an MP or a PA, and there should not be any surprise that if you go and you have an appointment with a physician, if that's your practitioner of choice, that you would then be seen by an MP or PA. Mainly I'm speaking, again, in clinic settings. It's a little bit different, though, in urgent care and the emergency room, where nationwide, the team in those settings tend to be a mix of PAs, MPs, and MDs or DOs. So maybe you can talk about that.
Yeah, especially in the emergency department, because of the volume of patients, it's impossible to staff with all physicians. And so we use a mix of nurse practitioners, physicians, assistants, and then physicians, of course. And we all work collaboratively. If the nurse practitioner or the PA sees a patient that they're having trouble with, I'm right there in the department. They come and talk to me. I go see the patient, and together we work to help them. And so in the emergency department and in some urgent cares that are really busy, you might not have a choice initially, but you can always ask to see a physician, and we'll come and see you.
Okay. So we're going to switch back to you, Erin. Okay. Some people choose their practitioner, whether it be an MD or a nurse practitioner, based on gender. They feel more comfortable, for example, being seen by a female.
Sure.
And then sometimes you go into that appointment and you're surprised because instead of being seen by a female, you're seen by a male. So what should a patient do in that situation? And is it okay to not be comfortable with that?
Yes, it's okay to not be comfortable with that. And I would go back even to the first question, that it really shouldn't happen. There's many patients that prefer a male over a female, and the whole basis of a patient and provider relationship is trust. And so absolutely, the patient should, if they're uncomfortable, just say, I prefer the male or male or female. And again, when you make the appointment, just be very clear that you're seeing who you're making the appointment with. And in general, it shouldn't be an issue. The patients should absolutely be accommodated.
To that point, and to carry it one step further, what should a patient do if they really are uncomfortable with not being seen by an MD and being seen by a nurse practitioner?
Yeah, they should either address it with the manager of whatever clinic they're at, or if they're comfortable enough, you can just say to the provider that's in the room that I would rather be seen by the physician. And that's okay. That's a patient choice, and it's absolutely okay for them to address their own needs that way.
So now I'm going to switch to you, Dr. Kunzweiler, back to you. So when you think about nurse practitioners and MDs, credentials aside, we're all concerned about quality of care for patients. So how can a patient feel really good that the care they're receiving is of the highest quality possible?
Well, I think it is difficult. It is good, I think, to talk to family and friends about who they're seeing and how they feel about their practitioner. So I think that's one way to get useful information. You can go online and find out about people's training and background. But I think ultimately you should feel that it's your right to ask questions of the practitioner, whoever they are, You should ask if they have experience in the kind of problems that you have. And then you should just get a feeling for, do I like the way they answer my questions? Do I feel like they're really listening to me? Does the treatment plan that they've outlined make sense? So I think you have to use all of these resources, and it really just comes down to, forming a relationship with your provider, whoever they are, whatever their credentials, and feeling that, they listen to you and that their answers make sense and that they're willing to get help if they need it. I think we all at times encounter problems that we're not familiar with, and whoever's taking care of you needs to be open to getting advice from other specialists and other practitioners. So not really an easy answer, but I think you just have to keep working at it like any relationship until you feel comfortable with the person. And if you feel like they're not listening to you or they're not really trying to help you, then I think you have to look for somebody else.
Anything you want to add to that, Erin?
No, I think the most important point that you said was patients need to feel that they're being listened to, that they're being heard, and every decision that's made is a decision made between the patient and the provider, and the patient has to be comfortable with that.
And so insurance can be an issue. In the few seconds that we have left, any advice to a patient when they're concerned that their practitioner might not accept their insurance?
Yeah, I mean, that is an issue, and really you just have to find out who is in your network before you make appointments. And generally, if you're calling the front desk of any clinic, they're aware of what insurances are accepted and who's in network. So it's really just a matter of digging in a little bit that way.
Well, we're out of time, and this has been a helpful discussion. Thank you both for being here with us this morning, and thank you so much for watching. We hope to see you again next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.